Hi, I'm Amy Geller, therapist, researcher, and adoptee. I hope you're finding this site to be an informative and user-friendly guide to therapy with adult adoptees. One of the tools I've discovered to be really helpful in my clinical work with adoptees of all ages is the genogram. Today, I'm going to quickly show you two examples of genograms, one that does not consider the client's adoptive status and one that does, to illustrate for you how this offers us a more complete client narrative with adoptees. Let's first look at a typical genogram. This is a fictional family I've created for illustration purposes. Here we see the client, Serena, is the second child of Bridget and Paul. The dotted line around Serena, Bridget, and Paul indicates their current household. Serena has an older brother, Michael, who has moved out and is living with his fiance, Brian. As is common, this genogram shows us three generations and has begun to map out some health history, losses, and emotional relationships. While this is not a totally complete genogram, we can see that it is already very informative for treatment. However, there is more to this family's story. Serena was adopted at birth. So now I'm going to show you a genogram that incorporates this client's adoption story. I've left out a lot of health and relational data from the first one, so we can really highlight the adoption specific details. Here you can see that I've changed the parent-child relationship for Serena, Bridget, and Paul to a dashed line to represent the adoption. Some apps use a solid and a dashed line. We see that Paul and Bridget gave birth to Michael in 1993, but then suffered secondary infertility that included two miscarriages. After 8 years of fertility treatments, they decided to adopt Serena. This time, we have added Serena's birth mother, Jolie, to her genogram, as represented by the solid biological child line. The family has very little information about Serena's biological family, but they do know that Jolie was no longer in a relationship with the father at the time of Serena's birth, and that the couple shared a son who was 2 at the time of Serena's adoption, Serena's biological brother. This version of the genogram tells us a lot more about Serena's life as an adoptee and her parents' experiences with infertility and pregnancy loss, all things that will be very useful in therapy. Genograms can be done effectively with individuals or families. They can also be created even if there is no information available about a client's biological origins. You can create biological parent icons and just leave them blank to represent unknown information. For some adoptees, their genograms will be updated as their adoption narratives evolve. I encourage you to explore using genograms with your clients. There are many apps available to assist in creating them. I've added a link below to some. Or they can simply be drawn by pencil and paper. On this page, you will find resources for integrating this tool into your practice, including a downloadable guide to some of the most common genogram symbols. And of course, you can always reach out to me with any questions. I'd love to hear about how you are putting genograms to use in your work with adult adoptees.